CEN test prep exam help. Question 1. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates option A, normal cellular metabolism, option B, hypoperfusion and anaerobic metabolism, option C, kidney failure, option D, liver failure. The correct answer is option B, hypoperfusion and anaerobic metabolism. Question 2. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects option A, acute myocardial infarction, option B, thoracic aortic dissection, option C, pulmonary embolism, option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. Question 3. The safe harbor provision for nurses typically refers to option A, a law that provides legal immunity in all circumstances, option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation, option C, a hospital policy allowing nurses to refuse any assignment, option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects option A, deep vein thrombosis, option B, acute arterial occlusion, option C, cellulitis, option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. Question 5. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock, option B, distributive shock, option C, cardiogenic shock, option D, neurogenic shock. The correct answer is option C, cardiogenic shock. Question 6. Testicular torsion is a surgical emergency that requires intervention within option A, 24 hours, option B, 4-6 hours, option C, 2-3 days, option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 7. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes option A, hypertension, bradycardia, headache, option B, abdominal pain, hypotension, and a pulsatile mass, option C, fever, chills, flank pain, option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. Question 8. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia, option B, hypercalcemia, option C, hypocalcemia, option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer, option B, diverticulosis, option C, esophageal varices, option D, Mallory-Weiss-Tear. The correct answer is option B, diverticulosis. Question 10. A patient leaving against medical advice, AMA, must be informed of option A, they cannot ever return to this hospital, option B, their bill will be sent to collections, option C, the risks and potential consequences of leaving, option D, the police will be called. The correct answer is option C. The risks and potential consequences of leaving. Question 11. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A. Atrial flutter. Option B. Prolonged QT interval. Option C. Osborne, J. Wave. Option D. ST depression. The correct answer is option C. Osborne, J. Wave. Question 12. A hyphema involves option A. Retinal detachment. Option B. A blood in the anterior chamber of the eye. Option C. Ruptured globe. Option D. Corneal laceration. The correct answer is option B. Blood in the anterior chamber of the eye. Question 13. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A. Fever, chest pain, friction rub. Option B. Hypotension, muffled heart sounds, distended neck veins. Option C. Hypertension, bounding pulses, headache. Option D. Dyspnea, crackles, pink frothy sputum. The correct answer is option B. Hypotension, muffled heart sounds, distended neck veins. Question 14. A female patient of childbearing age with abdominal pain should always be evaluated for option A. Ovarian cysts. Option B. Pregnancy status. Option C. Endometriosis. Option D. PID. The correct answer is option B. Pregnancy status. Question 15. When receiving a verbal or telephone order in an emergency, the nurse should option A. Carry out the order immediately without verification. Option B. Write it down and read it back to the provider for verification. Option C. Ask another nurse to take the order. Option D. Refuse to take verbal orders. The correct answer is option B. Write it down and read it back to the provider for verification. Question 16. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents option A. Uncompensated respiratory acidosis. Option B. Compensated respiratory acidosis. Option C. Uncompensated metabolic acidosis. Option D. Compensated metabolic acidosis. The correct answer is option A. Uncompensated respiratory acidosis. Question 17. The priority patient for a trauma team activation based on mechanism of injury is option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Question 18. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A. Pinpoint pupils and respiratory depression. Option B. A dry skin and absent bowel sounds. Option C. Hyperreflexia, clonus, and agitation. Option D. Bradycardia and hypotension. The correct answer is option C. Hyperreflexia, clonus, and agitation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates option A. Allergic rhinitis. Option B. Nasal mucosal secretions. Option C. CSF leak, rhinorrhea. Option D. Sinus infection. The correct answer is option C. CSF leak, rhinorrhea. Question 20. The purpose of administering surfactant to a patient with ARDS is to option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. reduce alveolar surface tension and prevent atelectasis. Question 21. Le-Fort fractures are classifications of fractures of the option A, mandible, option B, mid-face and maxilla, option C, orbit, option D, nasal bones. The correct answer is option B, mid-face and maxilla. Question 22. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, a synchronized cardioversion at 100 J. Option C, immediate high quality CPR and defibrillation. Option D, a transcutaneous pacing. The correct answer is option C, immediate high quality CPR and defibrillation. Question 23. The golden hour for acute ischemic stroke refers to the window for option A, completion of an MRI, option B, administration of 4 thrombolytics, TPA, option C, achievement of blood pressure control, option D, initiation of physical therapy. The correct answer is option B, administration of 4 thrombolytics, TPA. Question 24. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. Question 25. The antidote for benzodiazepine overdose is option A, naloxone, option B, flumazenol, option C, N-acetylcysteine, option D, atropine. The correct answer is option B, flumazenol.